Welcome to this presentation. We did a study looking at equine metabolic syndrome, or EMS, in a population of UK ponies and cobs. We're grateful to Boehringer Ingelheim and the University of Liverpool who funded this study, and these are the other declarations we have. Equine metabolic syndrome is a collection of risk factors for endocrinopathic laminitis, and the central and consistent feature is insulin dysregulation, and that's how we defined our horses as being equine metabolic syndrome positive or negative in this study. The aims of the study were to estimate the prevalence of EMS in the sampling in the population of horses. We also looked to identify associated risk factors, and by doing that, we hoped that it would enable us to identify horses at risk of EMS, and so identify those suitable for further testing. It would also allow us to implement management strategies based on a presumptive diagnosis, and also we might identify modifiable risk factors so that management could be improved. The study was done within a certain radius of Leahurst, and it was restricted to native UK ponies, their crosses and cobs, and that was according to the owners of the horse. We restricted the age to 3 to 15 years old, and we excluded animals with conditions or medications which we felt would affect their insulin sensitivity. The visit protocol: the evening before our visit, we'd ask the owners to stable the horse and to feed just one slice of hay. And then at 8 AM we'd visit, we'd do a baseline blood sample which we analysed for glucose, insulin, ACTH. We would feed a high glucose meal with 1 gram per kilo glucose in it. 30 minutes later we would remove that and any residual feed was weighed. And then we would do a clinical examination of the horse based around EMS features such as adiposity and hoof morphology. We'd do a face-to-face owner interview asking about management, exercise, medical history. And then 120 minutes after the feed was given, we'd take a second blood sample which would analyse for glucose and insulin. For data analysis, we looked at 2 outcomes. We looked at a binary outcome, so yes or no, did the horse have EMS? And that was based on cutoffs from the ECAM consensus statement, and we had different cutoffs according to the consumption of feed that the horse had. The second outcome was a continuous outcome, and that was natural log of the insulin at 120 minutes, and any horses with less than 75% of the feed consumed we excluded. We entered many explanatory variables into the analysis, but we divided them into 2 groups. Firstly, potentially causal risk factors such as age, management factors, season, and then clinical manifestations of EMS. So these are things that could occur as a result of EMS. So, for example, laminitis or hoof growth rings. The results: we sampled 352 animals on 64 yards, and after exclusions that left 339 in the binary outcome group and 320 for the continuous outcome group. The sample consisted of a fairly normal spread of the sexes. Median age was 9 years old, and then the most common breed we dealt with was Welsh, and then cobs, Connemara's, and then the others were the other native breeds. Most of the horses were overweight, so 75% had a body condition of 7 to 9. And when asked to classify their horses' body condition scores, owners had a tendency to underestimate the body condition score of their animal. The results: we found that the prevalence of EMS adjusted for clustering was 23%, and most of those animals were diagnosed based on the insulin at 120 minutes using the cutoffs that we did. Multivariable analysis, looking at the potentially causal risk factors, there were several variables that came out in the final model. So we found that age was associated with an increased risk of EMS, found that females had an increased risk of EMS compared to males. We also looked at the breeds, and compared to the Welsh A breed, all the other breed categories had lower risks of EMS. Looking at the activities of the horses, so we divided the horses into 2 categories according to their main activity, and those that had more strenuous main activities such as riding and driving had a lower risk of EMS compared to those with more sedentary main activities. And then overweight, horses which were overweight were at greater risk of EMS as well. There were two variables that came out in the final model, which was maybe slightly surprising and surprised us. So horses which had greater time at grass in the summer had a lower risk of EMS, and those that were rugged during the winter also had a lower insulin concentration at 120 minutes. So these are slightly surprising, and I just thought it was worth having a look at these. It's got to be remembered that this is just an association. So both of these variables have an association with a decreased risk of EMS. And so that's not to say that they are causal. And in fact, there's certainly possible that horses which maybe are overweight or have had laminitis in the past, the owners are aware of the existing advice, which is to reduce the amount of time on pasture in the summer, and then also maybe to reduce the amount of rugging during the winter. And the theory of reducing rugging is that the horses have to use energy to maintain their body temperature. Just thinking about the rugging though, and maybe playing devil's advocate to this, there's the thermoneutral zone of the horse, the lower critical limit. So this is the temperature below which horses have to actually use energy to maintain their core body temperature, is between 0 and 5 degrees C. And the average minimum temperature in January in the area studied is 1.4 degrees C. So according to that, it's very unusual that horses are actually having to use energy to maintain their core body temperature. So you could question whether or not rugging makes that much difference. And it's possible that rugging could affect the amount of movement they do or the amount of exercise they do as well. And I think this is quite an interesting area for further research. Looking at the clinical manifestations, unsurprisingly, occurrence of laminitis in the last 5 years had a very strong association with an increased risk of EMS. And then the growth ring score, so those that had a growth ring score of 3 were at greater risk of EMS compared to 1. And I think really we need to redefine what we refer to as laminitic. Traditionally, we refer to as a horse as laminitic if they actually have visibly a gait abnormality as a result of painful feet or a visible gait abnormality. Whereas I think arguably the horses with the feet below in those photos with the prominent growth rings, even though they might not have detectable foot pain, I think likely that this is subclinical laminitis going on, and certainly it is associated with EMS in our study. One limitation was the non-consumption or reduced consumption of feed by some horses. Luckily, 86% of the horses in the study consumed 100% of the feed, and only 2.6% consumed less than 50% of the feed. We were interested in knowing whether or not it's possible that the EMS horses were less inclined to eat their feed or ate more slowly. The two graphs at the bottom just look at all the horses that consumed 100% of their feed, and you'll see there was no association between EMS status and the time to complete the feed, and the time to complete the feed and the insulin concentration at 120 minutes. So from that very quick analysis, it doesn't appear as though EMS horses are sort of greedier and eat their food faster or more willing to eat their food than non-EMS horses. But again, that's an interesting area for further study. So in conclusion, EMS was common in the population of animals studied. We identified risk factors that allow us to identify at-risk horses better, and that will allow targeted testing and presumptive diagnosis. And then there are modifiable risk factors that exist for management changes, but I think there's some further research required looking at whether those are a cause or effect. Thanks very much for listening.